Hi nurse family, today we're going to talk about IV start, how to initiate an IV, okay? Now out of all of the skills that we teach nursing students, IV insertion is typically the most requested skill. And I know that many schools do not usually teach IV insertion. That is because in the clinical sites, when you go to clinical, you're not going to be allowed most likely to insert an IV. So learning it in school and not being able to practice it, by the time you get to the clinical area as a nurse, really it would have no benefit to you. So in most cases, I know some schools do teach it, but in most cases, you're going to be learning in the classroom in your hospital when you start working as an RN. And then, believe it or not, you're going to be practicing on real patients. Don't worry about that, because usually the nurse that is precepting you is going to find IV sites, or veins and patients with veins that are very easy to access, and they're going to be guiding you through the process. So you're not going to be doing it on your own without knowing what you're going to do. But today I'm going to show you basic concepts of how to insert an IV. Okay, I want you to keep in mind that depending on your facility, the supplies that you have might be different. So some things that I might talk about might be different from what you see in your facility. Okay, all right, so here we go. So whenever you're going to initiate an IV, you really need to think about what is the purpose of this IV. Is this for blood administration? Is this a trauma victim? Is this a patient who's just going to be receiving IV fluids? That's going to help you to decide what size gauge you're going to use. For the purpose of this video, we're just going to focus on inserting the IV, but be sure to tune in for my other video on how to choose the appropriate gauges, okay? Now, I'm going to show you first. I'm going to want to gather my equipment based on what I'm going to be using. I'm going to choose my angiocath today for the purpose of inserting an IV into my mannequin here. I'm going to use a 20 gauge. That's the most appropriate. I just want to open everything up so you can really see what these look like. Now this is just one type of IV angiocaths. Okay, there are many different ones. This is pink. So in my facility, every time I see a pink angiocath, I know that it's a 20 gauge, which is a nice size IV for the typical things that I'm using it for. Okay. The next thing I have is my IV start kit. And in my IV start kit, I have my Tegaderm, which is basically a semi-permeable adhesive that's going to go over the site to protect it. Help keep it in place. I have a little roll of tape, and I have this chlorhexidine swab. Your facility, and this is called a ChloraPrep, your facility might use alcohol or it might use chlorhexidine, so you just need to know what your facility requires. Okay, I also have a sodium chloride flush, 0.9% sodium chloride, which is the same as normal saline. And I have my extension set tubing, which is basically the tubing that gets connected to the angiocath once it's inserted, and this is where you would be administering medication. So you don't administer medication right into the angiocath, you're administering it through this port, and notice that this port is a needleless system, so this is where I'm going to be connecting my flush. Okay? All right, so I'm very lucky. I have these amazing arms here that will give me blood return when I insert them. But before I do that, I kind of wanted to show you or at least give you a better visual of what you're doing when you're inserting the IV. Before we go ahead and go through all the steps of inserting an IV, I wanted to give you a visual of what it looks like when we're inserting a catheter into a patient. So this is going to be my vein. Okay, now obviously, some veins are more superficial than others. Some veins are deeper, some veins are bigger, some veins are smaller. So I just want you to imagine that this vein is a superficial vein, and I'm just going to hold it taut for the purposes of, I don't want to stick myself. And I'm going to insert this angiocath almost a little less than 30-degree angle, okay? So what I want you to take note of, when I insert the angiocath, you notice that I'm on an angle. But do you notice that if I continue on this angle, what is going to happen? I'm going to go right through my vein. Okay, so if you notice, I just want to lift this up for you to see. If I continue at this angle, I'm going to go right through my vein. So once I hit my vein, okay, what I'm going to want to do is go down and adjacent to the skin. And that's now going to allow me to push this angiocath in further. And you can really see here that now my angiocath, which is the plastic catheter that's around the needle, is in. And what I'm going to do is retract this needle by pressing this button. Okay, and the needle comes out and the angiocath stays in the vein. So that's what that looks like. So now let's try it on the arm. Okay, so I perform hand hygiene. I'm going to elevate the patient's bed, or sometimes I grab a chair. You really want to make sure that you're using good body mechanics and you're not bending over, since it might take you a while. Okay, so you want to make yourself comfortable. So I have gloves on. I'm going to go ahead and put this tourniquet on the patient. Remember that when you're thinking about where you're going to insert this IV, it really depends on what's happening with your patient, or sometimes what's available to you, right? Maybe the patient's arms, they don't have good veins, and so you're just going to grab what you can get. If I am using this for long-term use, in the ideal situation, I want to start lower. So I want to start in the hand so that if it gets infiltrated, I have other sites that I can use. Usually we start in the antecubital when there's an emergency. It's a nice big vein. It's a very easy vein to access. It's closer to the heart. But for long-term use, it is not ideal because the patient's going to be bending their arm, and so it's going to frequently interrupt the medication administration. So I'm going to put the tourniquet up here because I'm going to use the forearm on this patient. I see that the patient has really nice big veins. I'm going to go ahead and just cross this over like this and just put a little loop in there. This takes a little bit of practice, so grab a tourniquet and bring it home and practice. In this facility, we use the ChloraPrep. Again, you might be using alcohol or betadine depending on your facility. The way you wipe also depends on your facility. So oftentimes we start in the middle, okay, and go outward in a circular motion. We're gonna wipe for 15 seconds. Other facilities might have you wipe up and down vigorously for 15 seconds. So you need to know what your facility wants you to do. While this is air drying, I'm not going to fan it. I'm not going to dry it with a gauze, and I'm most definitely not going to blow on it. I'm going to gather my supplies. So I have my Tegaderm, which I'm going to open. And I tell this to my students all the time. Before you engage in a task, think about what supplies you have to gather and set up. Because remember, you're going to be limited in what you can do, right? In a minute, I'm only going to have one hand available to me. So I'm going to gather everything now. I have my extension tubing, and I'm going to go ahead and put the saline on. And most of the time you can flush with the cap on. I'm going to go ahead and flush until I get all the air out. The saline is coming out of the tip. So you see that, okay? And what I like to do is just loosen my cap, but not completely take it off, because I want it to be easy for me to grab, but I do not want it to get contaminated. If you use tape, this is when you want to gather that now. Okay. I'm taking a lot longer than I usually would, but I should mention that if you're taking a long time, you want to be mindful that the tourniquet is on your patient's arm. So make sure you're being mindful of that. And I have my angiocath here, which we said we're going to use a 20 gauge. So you can see that the catheter, the plastic catheter, is over the needle, and I'm going to want the bevel facing upward. All right, so hand positioning. My hand is going to go here. I'm not going to do what I did earlier with the tubing where I had both fingers out, because I do not want to stick myself. So I'm going to stabilize the arm, and I'm also going to hold the vein down, being careful not to touch the area where I'm going to insert the catheter. So bevel is up. I'm going in at a 20 to 30 degree angle. Okay, and I know that I've hit the vein, and I already see some flash of blood here. Now, depending on your facility, you might not have a flash of blood, because what they use, some of the angiocaths don't give you the flash of blood now. So I don't really like those, but personal preference. I'm going to release the tourniquet. And I'm gonna go ahead and put my finger over here. Now in a real patient, usually when you do this, it's enough to stop it from bleeding. These arms tend to still bleed, so I might get a little bit of blood. That's why I put my chuck under the arm, because I wanna make sure I don't contaminate my patient's bed. So I'm gonna press this white button here, and that's gonna allow me to retract the needle, okay? I'm gonna go ahead and grab my extension tubing and connect it. Now, sometimes in the haste of trying to get everything on, we forget to really tighten this. So be sure to tighten it, because otherwise later on you'll have a leaking IV site and you don't want that. Now I can clean it. This was the gauze that was in my kit, so it's clean. I'm gonna dry it to make sure it's not wet, and I'm gonna go ahead and put my transparent dressing over it. And I like to put it completely over the port. Some people put it a little higher up. I just feel that it protects it more from infection by covering the entire port. And then there's this little paper here that I'm going to grab. And as I'm pulling the paper, I'm making sure that my adhesive is sticking to the patient, okay? Okay, on this paper, this specific Tegaderm does have an area where we would write our date, initials, and gauge. So I would go ahead and do that. And I always take my gloves off when I use my pen, so that's something important to say. You take your gloves off, and then I would go ahead and label this so that the next nurse knows that this IV site is new. Now I can go ahead and pull back and flush. I probably would have did that before I put the Tegaderm on. And I'm gonna go ahead and clamp my tubing and cover this port with an antimicrobial cap. And then I want to secure this tubing because I don't want this hanging all over the place. So the way that I do this, everybody does this a little bit differently, but the way that I do it is I try to use the least amount of tape as possible. So I will, first I like to see where does the tubing feel like it wants to bend, because otherwise it's going to give me resistance. See if I'm going here, how it's already trying to pull that way. So I'm going to go this way, being mindful of the patient's arm, and I'm going to put the tape right over the adhesive, over where, close to where the port is. And now I still can move this around if I want to access it with my saline flush or with my IV fluids, and I'm securing my extension tubing and my angio cap. Again, that's just preference, okay? Head and put my sharps in the sharps container. I'm going to grab all of my supplies that go in the garbage, put them in the garbage. Make sure my patient is comfortable. Lower their bed. Remove everything that needs to be removed. I'm going to take off my gloves, perform hand hygiene, and go document that my patient now has a 20 gauge angio cap in the right form. Okay, so that's how you start an IV site. Be sure to check my video on common IV site complications and how to decide which angio cap to use for each type of vein. All right. Hope you enjoyed this video. Go ahead and like and subscribe and let me know what you thought about the video. Bye.